We have been working on putting together a surge healthcare force. Go back to the retirees, go back to nurses and doctors who may not be in the hospital, direct medical care occupation, and ask them to sign up for possible reserve duty.
We have a supply and demand issue in the United States. We have too few residency positions for the number of medical students that graduate and are qualified for those every year. Add to that, there are international medical graduates that sometimes are awarded those residency positions, so you have even fewer.
No matter how much ground we make up in terms of increasing the number of medical students, which we have done over the last 15 years, if you don't increase the number of residency positions, those students, then physicians, cannot go on and practice independently and take care of you, me, our neighbors, and our families.
I've heard stories of many really qualified medical students who did not get a position in the residency match. Every state requires at least some residency training before you can apply for that medical license. Without that residency, you don't have a board certification. So you do have a lot of students who are unmatched, who have been reporting working at delis, working as baristas. They might be teaching, at a community college or something like that because they have an MD, but they cannot work clinically. Service industry jobs are really common, bartending, waitering or waitressing. There are a lot of unmatched students driving for Uber and Lyft, I will tell you that. There was a provision in a bill under Clinton that sort of froze graduate medical education funding, like it was part of the Balanced Budget Act. So, it sounds good to save money, but the reality is that we have a really big aging baby boomer population that's going to need a lot of care, and we need physicians to actually execute that work.
We have legislation in both the Senate and in the House, and that would help us get rid of that freeze on spots and increase training by just a couple of % a year. The challenge has been from people who say, look, we don't think that the training system is perfect. We don't think that we should be spending more money right now. The cost would be roughly $1 billion a year in a $3 to $4 trillion healthcare system. I don't think that is a large amount of money to ensure that we actually have doctors out there that will care for you, me, our relatives, my mom, our neighbors, and our friends.
It would take, honestly, not that much money allocated in terms of the federal government to fix this problem. And there, not only would you have these medical graduates able to train and get a job, but you'd solve some of the doctor shortage. These are students that would be really grateful to train anywhere and get a job anywhere in most cases. And while we wring our hands saying there aren't enough doctors in rural locations, there aren't enough doctors in Mississippi, for example, if you create that supply, you will have enough doctors licensed in those states who can actually go and provide care. It's shining a really bright light on this deficiency that's been present for far too long.
I think what the current crisis has exposed is that we have been at a very tight supply. And people have said, well, maybe we can be more efficient. Well, maybe we can use technology. All those things are great. All those things are important. But the challenge is when you're at this tight of a supply, if anything goes wrong with us collectively as a neighborhood, as a community, as a nation, people are going to suffer. And so now is the time, late as it is, to resume paying for that additional training because we're going to need it. When this crisis is over, and hopefully that's soon, we're still going to need those additional physicians out there.